and welcome to Digital India Summit, a premier initiative by the Times Network. This year's theme is talking about enabling a revolution. Now, one sector that has seen pretty much quite a big revolution, especially in the last 2 years, is the healthcare space. But today, I'm joined by two very eminent doctors who are going to be talking about a niche space in the healthcare space, if you might say. We're going to be talking about robotics and how that field is evolving, is changing, is making things better for humans as we go ahead. Allow me to introduce my two experts. We have Dr. A.V. Guruvareddy, the Chairman and Managing Director of Sunshine Hospitals. And we also have Dr. Adarsh Reddy, Executive Director, Sunshine Hospitals. Both are joint replacement surgeons. Thank you so much, gentlemen, for joining me here today. Dr. Guruvareddy, we'll start with you. In India, post-pandemic, there's been a lot of technological innovation. It's been happening at a much faster pace than was anticipated before. And when we talk about these specialized robots, compared to the Western countries, in India, this is used much less. What are some of the main factors that are playing a role in this roadblock, according to you?
That's a very good question. The personal interface or the human touch is very important in our culture. So especially in healthcare, when somebody falls sick, many people come and visit them both at home and in the hospital. You should see the visiting hours of Indian hospital. It will be swarming with people. That is in our sight. That is one way of expressing our affection and our love and our kinship. So the robots are never going to replace the human space in healthcare, especially in India, especially in the OPD activities like taking the pulse, greeting the patients. There may be one novel robot here and there, but they are never going to replace the human interface in that space.
So thank you, Dr. Guruvareddy, for setting the context on a wider scale. But Dr. Adarsh, now I'll come to you with some specifics. Let's go deeper into that. And when we talk about specialized robots in surgery, how are you seeing them playing a role? What are some areas that you're seeing these robots being really helpful, or rather these robots really being used in?
Oh, it's a good question again, Sumit. So robots are slowly entering into the medical space, but they're more useful in the surgical space, especially in medicine. Surgeries are definitely going to benefit more from robots. Around the world, already a lot of robots are being used. If you talk about what type of surgeries, the Da Vinci robot has been there for quite some time now for general surgeries, for urological surgeries and prostate surgeries, etc. And now we're specifically talking about joint replacement robots because we both are joint replacement surgeons. And I would say, in fact, in America and Australia, almost 75 to 80% of these joint replacements are being done with the help of robots already. So it's already slowly creeping into the surgical space. In India, the major cities have already acquired robots for joint replacement surgeries. And definitely we are slowly catching up with the Western world in terms of robots in surgical practice.
Okay, that's interesting to know. And it's great that you've shared these statistics to put this more into focus. We will come, Dr. Adarsh, I will talk to you about that in a bit more. But Dr. Guruvareddy, I just wanted to know one more thought on how these robots are being used by surgeons. How are they helping these surgeons? Maybe are they helping them to perform these surgeries with greater ease and precision, or are they helping eliminate surgeons' fatigue so that more surgeries might be happening in the same number of hours or the same period of time? Can you shed more light on that?
Yeah, robots have come into surgical field first in the urological surgery. That is prosthetic surgery, where the very inaccessible areas. So those areas the robots can enter and do the dissection of the tissues with absolute spot-on accuracy without disturbing any surrounding or damaging the surrounding structure. It is like a laser gun targeting the specific target and not disturbing the other tissues. Because if you take prostate, it is such a delicate area where there are a lot of important nerves, like a pudendal nerve, those nerves are there. So in those cases, really robot has come and the surgeon has to just stick there and use the joysticks, and the robot will not have any tremor, and it will exactly go and do the tissue dissection with such a millimeter precision in the shortest or closest possible space. That is the best advantage That's why the robotics came into field. Then the gynecological surgery, hysterectomies, oncological surgery, it all happened. Now in our branch, in the orthopedics and joint replacement, the robots have come and they have definitely, we cannot do the joystick or you sit outside and let the robot operate. Because here it is called hard endpoint. Unlike prostate and soft tissue surgery, it is a hard endpoint. That means the bone. You are cutting the bone. So that hard endpoint needs the surgeon also to be there and use the robot. So it's slightly different technically from the robot perspective. But the robotics in joint replacements are gaining momentum. And in fact, if you ask me about the knee replacement or hip replacement, 90, let us say there are 100 steps to get a knee right. Out of 100, 90 steps you do by eyeballing and by using your experience. And that is not on in 21st century. So because precision is the important game. So precision again and again. And that is where the robots help you a lot in joint replacement surgery.
So it's definitely a combination, you could say a collaboration between a robot and the surgeon. So because Dr. Adarsh, one concern is always there that, and especially it's happened a lot over the last few years where technology, wherever it has come into whichever field, there's always a lot of conversation that, hey, is this taking jobs away? Is this taking, now I'm sure people must be asking you about this part, that is this robot taking away the surgeon's job? But my sense is it's more of a collaboration between both of them. Could you shed more light on that?
Correct, Sumit. So it's, I think, first thing that comes to people's mind when they say robots like the Matrix or Terminator, where it kind of wreaks havoc. It's not like that. There are different types of robots, especially in the surgical field. There is fully automated robots and there is semi-automated robots. Now, fully automated robots are the ones like Dr. Gurvar already mentioned in the urological space, where you have your surgeon is sitting in a completely different room using a joystick, and he's getting access to that particular joint, to that particular tissue. In the joint replacement field, we do have fully automated as well. But the one that we use and the one that has got proven outcomes as well is the semi-automated robots. So here still it's the surgeon's skill which is very important. More than replacing the surgeon, that's not major issue here. The point is you still need to have that soft touch. Unless that surgeon is still skilled, he knows where the robot has to stop, knows where the saw has to go and all these things, he is not going to be able to get the benefit from the robot. So these robots are assisting the surgeon. So it's a semi-automated robot where the surgeon is still doing the procedure, but the robot is going to make sure that the accuracy and the precision is improved, and it's going to make sure that the least amount of tissue is being cut and resected.
So it's got to be able to do this finely, as I would like to say. That's a really important part there. So then Dr. Adarsh, quickly, I'll just come to the first part that you started with, and you said that this is where the robot is in one room and the surgeon is in another room. Now, one part of technology that's been, when they talk about med tech, is about saying a doctor in an urban city is able to do a video call with a patient in a rural village and kind of guide them. So could this be, or is this already happening, where there's a doctor in an urban city, for example, urban hospital, and there's a robot in a rural hospital, and the surgeon is doing a bit of the surgery there?
It is there in some places in the world. As I said, the urological and the general surgeries, some of them are being done like this with the use of internet. And
even cardiac surgery is also
cardiac surgery also. At the moment, in orthopedic surgery, it hasn't. I per se wouldn't want a robot to be like wreaking havoc on my knee without a surgeon there. But of course, the things may change in the future. It may come to that stage.
So, in sense, Sumit, even when the robot will not be there unmanned in the remote area.
Right.
There will be a surgeon, probably a junior expertise-wise, a junior surgeon. He will have the robot, and the surgeon in the urban center who is an expert, he will give the guidance to program the robot, and the junior surgeon will hold the robot and do the operation. So robot will not be there unmanned. No, is only in cinemas, not in the real picture.
Great. So, but again, that is just, one of the possibilities that we have for this.
Definitely in the future.
So, Dr. Gurvar Reddy, you spoke about these robots being used in prostate surgery, in orthopedic surgery, in your field of expertise in cardiology. Are you seeing this being used in other sectors? Any more areas in the medical space that you see that going ahead could be benefited by robotic surgery?
Yeah, you see, surgical field, the robots will be there. It will be there. It's already there in the neurosurgery. It is there in the gynecological surgery, urological surgery, cardiac surgery, and orthopedic surgery, joint replacement, spine surgery. The robotics are there in the surgical fields, and in future also it will come into major micro procedures as well. But when it comes to the medical field or non-surgical fields, the robots also might come into the future, but they will come with artificial intelligence and the big data. So I would say the robotics, but there is artificial intelligence and big data. That is another facet of the artificial intelligence. Basically, now let us say one patient comes with a cough. Now the doctor has to take his history and take his chest X-ray, take his CT scan, take his ultrasound, and then using his experience and his past experience, he has to come to a differential diagnosis. But in the next 5 years or 10 years, you don't need to do that. You just cough with the simple cough and with one chest X-ray, the artificial intelligence can put up, this guy has got this diagnosis, full stop. So that is already gaining momentum because big data, just like our field also, for example, we got a gross deformities, arthritis, people will come with horrendous bowed legs. So in that, we got to use your expertise, which ligament do you release, how much bone to cut, how you align the bones and all that. In the robot, once this big data and artificial intelligence and the machine learning comes into picture, it is now slowly evolving. In the next decade, probably, if I'm not there, my son Adarsh will see that a robot will give you a complete algorithm or a roadmap of how to deal a particular arthritic patient. It will tell you stop, do the ligament, cut here for 2 millimeters and stop. Cut this bone 5 millimeters and stop. And go to the backside, there is a big osteophyte, take that off. Like that, it will give an algorithm and it will take us through.
Wow, fantastic. That will definitely make things easier and better for all the patients as well as the surgeons.
Absolutely, yeah. End of the day, whatever robots come, Sumit, the patient has to be the winner.
Absolutely.
It is not the surgeon, it is not the hospital, it is not the economics. The patient has to be the winner. So any field where the end user gets the better outcomes, there the things will be happen very, very well.
Dr. Adarsh, I want to take the conversation a little ahead to a different angle, you could say. We've spoken about robotics. The surgeries will help patients. They're helping surgeons also perform better surgeries. But the surgeons need to be skilled to use these robots because otherwise, they're of no use. They're just pieces of iron and steel in somebody's hand that they don't know how to use it well.
Yes.
The training centers in India are few for this. So what's your take on that? How can we, fill up the gap?
It's a very good question. Again, as I said earlier, the robot is not going to be doing the procedure on its own. You still need the skill of the surgeon. You still need to know how to do a joint replacement. Because I'm a joint replacement surgeon, I'm talking specifically about that. You still need to know what are the cuts you need to get. What is your outcome that you're aiming for? You want to have a straight leg with less amount of pain, with no arthritic bone. That's basically what you're trained in. So you need to know that. But robotic surgeries also has a different kind of skill set, which you need to know. You need to know how the robot is going to assist you, where exactly it's going to come into the play. So when we acquired our robot, we had to go to the US and Australia to learn and to get trained in this. But now we ourselves, Sunshine Hospitals, Sunshine Bone and Joint Institute, we are a center of excellence ourselves now. So we are training people from all around India. So there will come a time soon where we won't have to go abroad to learn these surgical skills or these robotic surgical skills. And it is coming quite fast. Already in the general surgery robotics, there are the institute in Kerala, Amrita Hospital, they're a very good training center for robotics. And now Hyderabad, our center is there for joint replacement robotics. So India is definitely coming up to become a very good training spot for people around. In fact, not just India, around the world, people will come and train in India soon in robotics.
Yeah, another point, Sumit, here is India will score in the coming decade in the robotics because here the human resources and the infrastructure costing is 1/4 or 1/5 of the international. So let us say if you need to put $100,000 to start a learning center in America, it will cost you hardly $20,000 here, 1/5 of the cost to start a learning center. So in fact, we are now on the verge of, we are exploring and we are on the verge of starting a cadaver training center for the robotics in the near future.
Yeah.
So which will be, once you set up the standards, people from all over the world will come to India to learn.
That will be great because that will again help us also, all the people, again on a larger scale, the economy and all those angles also, but definitely helping our overall healthcare system improve. Since we're talking about cost, Dr. Guruva Reddy, I do want to talk to you specifically about the cost for these robotic surgery because, well, obviously they will be costly. So how do you see that gap coming down later? Do you, as other things, do you expect that in the future the costs will keep coming down? How will the larger public be able to be benefited by this eventually?
One of the criticisms or the skeptics keep on saying about the costing of the robotics, which is valid to some extent. But the robotics per se, the joint replacement, you don't need to charge lakhs and lakhs of rupees for an extra robotic surgery. So at the most, let us say in dollars wise, you just need to spend another probably $500, $600 more than in a conventional surgery to get the extra robotic space. Number two, the robots also getting cheaper year by year because once the quantum and the critical numbers are increasing, the robots are also getting cheaper. Then number two. Number three, insurance companies are now coming into the fold, accepting robotic and cosmetic surgeries also by offering the clients a special premium for that. So a lot of insurance companies are coming into the fold and now they will offer robotic surgeries also within their scope.
I think that will be the major boost for robotics when insurance.
All the factors put together, it will become, robotics will not become unaffordable in the near future. Anybody who can afford a joint replacement can afford robotic joint replacement as well. There's no doubt about that.
Yeah.
Interesting. And so, Dr. Adarsh, what would you, and I'll come to you also, Dr. Guruva Reddy, same question. But Dr. Adarsh, where do you see this heading for the way ahead, this innovation that's coming up, the evolution of the healthcare sector? Again, specifically, I'm talking about robotic surgery and in the joint replacement space. Yeah. What's the future like? What can we expect in 5-10 years?
So one thing, Sumit, robotics is not compulsory or not necessary to do a good joint replacement surgery. Since the last 15 to 20 years, I'm talking about India, last 15, 20 years, we've had wonderful results with thousands and thousands of patients doing really well with joint replacements. Robotics in joint replacement surgery has probably entered the discussion over the last 2 to 3 years. Okay. But on the same page, though it's not going to be compulsory in the near future, I would say that it will become omnipresent. People are already asking, especially the educated crowd, the educated people are asking for robotics. They know the advantages that patients have with it. So I would say the healthcare institutes, at least the big institutes, they need to adopt robotics to at least make sure that they're not becoming obsolete. They should not fall behind. And because there is much more accuracy, people are having faster recoveries. I won't say that it's the God's gift to mankind, but definitely there are faster recoveries and better outcomes. So like just how a C-arm is something which we use regularly in surgery. It's a portable X-ray which we use in trauma surgeries. That is almost every orthopedic center has that now. So I would say at least the major institutes will adopt robotics in the near future.
In that context, Sumit,
yes.
If anybody says robotics is the way to go and it is the only way to go, he is not telling the truth. As we do a lot of robotics in our hospital, but at the same time, we do non-robotics also. We have been doing it for the last 20 years myself. So there are excellent surgeons all over India. So there is no dearth of good surgeons giving a good outcomes, which has been published and which has been standardized all over the world.
Yes.
The robotics will add to your experience that accuracy that you will get 100 out of 100 again and again and again. So
And
that is the beauty of this thing.
reproducibility.
And a lot of people keep on asking, okay, this is all good for you. What is good for the patient?
Mhm.
Again, as I said before,
Yeah.
unless there is some tangible better outcomes to the patient, no
Yes.
technology will survive in healthcare, especially healthcare, because the end user is the one who pays for it and who feels it, who feels the beauty of it. So in that context, I'm pleasantly surprised, to be frank. It took me 5 years to marry the concept of robotics. But after the robotics, we have taken the robotics in the last 3 years, the post-operative pain is significantly less in robotic patients compared to the manual. The reason is nobody is sure, but the one hypothesis is the inflammatory markers. That means the chemicals which are released when you cut the tissue are less released in case of robotics because we are not cutting all the tissue. So we are just opening one window rather than one whole two doors. Let us put it that way. So in that way, the inflammatory markers are less and you don't violate any tissues which are not needed because haptic boundaries are there. Again, another beauty or another advantage of the robot, this especially the robot which we use, the Mako robot, it has got a haptic boundaries. That means basically it will define the boundaries. In between only you can operate. If you go beyond the boundary, the saw will stop.
Yeah.
That is the beauty of it. So though you are in control, after the boundaries or beyond the boundaries, the whole robot is under control. It won't let you do it. So that is another point. Third point is, but gives more flexion compared to the manual. And a lot of people are able to squat within a couple of weeks. And again, it's a big, in India, a lot of people want to squat for religious pujas and all that. That is again another added advantage for Indian population, that bending. And again, I'm not saying that only robotic knees can bend and squat. Manual knees also, a lot of people sit and squat. But robots are doing it again and again. Let us say if I operate 100 patients with robot, out of the 190 are able to sit on the floor within a month. Whereas in manual, around 50 to 60% of people will be able to sit. So that sort of outcomes are good for the patients.
Fantastic. Well, that's all the time that we have today on the show, but it's been an absolute pleasure to talk to you, Dr. Guravareddy, and to talk to you, Dr. Adarsh, to know more about what's happening in this space and to see and to know what are the developments that we can expect. But I think one of the main messages that we should be taking back from here, maybe two of the messages. One is that, yes, there is an evolution happening in this technology is improving to help surgeons, patients, but most importantly, the end result, the end user should always be benefited by it, which in this case is the patient. And that is what is always at the heart of anything that gets implemented successfully in the healthcare sector. This was a very special episode of Digital India Summit, a premier initiative by the Times Network. And I was in conversation with Dr. A.V. Guravareddy, Chairman and Managing Director of Sunshine Hospitals, and Dr. Adarsh Annapareddy, Executive Director, Sunshine Hospitals. Thank you so much, gentlemen, for being a part of this.